Greetings, my name is Kayla Fitz. I am a student currently, student physical therapist at Florida A&M University. And if you're watching this video, then you or someone you know are struggling with sciatic nerve issues. So I'm not a professional yet, but I do have some experience with sciatic nerve patients, being in the clinic, clinical rotations, all of that, and family members and friends who have sciatic nerve issues. So this video is going to give you a few exercises that can hopefully take care of some of those issues, exercises, stretches, things of that nature that will help target that sciatic nerve, help give some relief to that nerve. So without further ado, let's get into it. This first exercise, quote unquote, will actually be a stretch. So this stretch is called a piriformis stretch. And if you do not know, the piriformis is the muscle that the sciatic nerve runs through. It kind of sits below your glutes. So it's back here in this area, the buttock area. And when that muscle gets tight, it compresses that sciatic nerve, which gives you those sharp pains, those symptoms that run down your leg, the back of your leg. So let's get into it. There are a few different ways that you can do this piriformis stretch. The first way you can do it is sitting up just like this in a chair or on the side of your bed, wherever you want to sit, on your sofa, whatever. And the affected leg, so the leg that is having the sciatic nerve issues, you would cross it over, don't get my toes too much, you would cross it over your other knee, your opposite knee, and you will pull the affected knee towards your opposite shoulder. So if your right leg is having sciatic nerve issues, I want you to cross your right leg over your left knee. You're going to pull this knee towards your left shoulder or opposite shoulder. I'm just going to hold that for a few seconds. Depending on how many reps you want to do, if you want to do at least 10 reps, you can hold it for 10 seconds. You want to do just 3 to 5 reps, hold it for at least 15 to 20 seconds each. Just going to let that go. And you're going to repeat that. Once again, this is targeting that piriformis muscle. That's giving that sciatic nerve some tension. So we're kind of loosening up that muscle, loosening up the tension on that nerve. This is the second way you can do this stretch. Lay down, same thing, except now your opposite leg is going to be bent on the surface. You can lay on your bed, lay on your couch, whatever. You're still going to cross that right leg or that affected leg over the unaffected leg. And this time, you're going to place your hands underneath your knee. I can do it this way so it's a better visual. This time the left knee is affected, or the left leg. I'm going to grab behind the knee of the unaffected leg and I'm going to pull back here. Like I said before, same stretch, just a different way to do it. So whichever is better for you. I'm stretching that left side. If you want this side of visual, I'm stretching that right piriformis right here. All right, so this next exercise is called sciatic nerve glides. So this exercise is going to kind of stretch that nerve. We call it nerve flossing or nerve gliding. It's going to move that nerve back and forth. So you might feel some tension on this. Just know that that is normal, but it's going to kind of move that nerve back and forth, hopefully to loosen up that nerve so that when you walk, when you take a step, you won't feel the sharpness, the tightness, and the symptoms of that sciatic nerve pain. So show you how to do this one. For this one, once again, you're going to be laying down. You're going to hold behind your right knee. You're going to start with your knee bent. And then the first step is you're going to extend your knee. Bring your toes towards you. I feel that tension already. Push your toes away from you and back down. And that's the full glide. So the first step in the glide, extend your leg. Second step, toes towards you. Third step, toes away from you. Fourth step, bend that leg again. Ultimately, this is how it will look. And you will feel tension behind there, especially if you have issues, but the tension should decrease and decrease the more that you do this stretch. All right, so we got a couple more exercises now that you made it through those first two. This next one is another stretch that you're going to do. And I know some of us haven't done this in a long time, but it's called the child's pose. And if you're not familiar with yoga, I'm going to show you how it looks. So For this one, I want you to do this at least 5 to 7 times, and we're going to do 3 sets of it as well, holding for at least 20 seconds each. So, child's pose. You're gonna get on all fours. Hands are stretched out. You're gonna rock back. Should feel a good stretch in your glute area. So I want you to rock back as much as you can. Get a good stretch back here in your glutes. Hold it for at least 20 seconds. And then you're gonna come out of it. And then you're gonna rock back again. All right, so that's another stretch that you can start working on. I'm gonna give you one more exercise, maybe two more, we will see. All right, so I decided to do two more instead of one more, but this next exercise is basically a hamstring stretch, and we're gonna use a strap with this one. So you're gonna be on your back. This can also help with lower back pain. You can also do it in different directions depending on if a certain direction gives you more symptoms than another, but I'm gonna show you and explain all of that as well. So let's get into it. All right, so for this exercise, like I said, I want you to at least have a strap or something long. If you have a long sheet, a long towel, or if you have a dog leash, anything that can stretch and wrap around your toes or your feet, I want you to use that. I'm going to use my gait belt, but I know not everyone has a gait belt. So anything that can stretch from here to there that you can pull, I want you to use that. So for this exercise, you're going to be laying on your back. You're going to use your strap to pull your leg up until you feel a nice stretch in the back of your leg going all the way down, and I feel it right there. You're going to hold that for a few seconds. You're going to go back down. This is a good hamstring stretch, like I said before. However, this can also be a good stretch for the sciatic nerve. Pulling up as high as you can until you feel it. You might only be able to go here, but at least it's doing something. So go as high as you can until it provokes those symptoms that you've been feeling with the sciatic nerve. And I want you to stop there. Like I mentioned before, this can be helpful for the lower back. And if you want to get different directions, different angles, you can pull it to the side. Make sure that your hip does not go with you, or else you will not get the stretch that you're supposed to be targeting. So I want you to make sure that you hold your hip here, just to make sure that the hip is not going with you and that you're just pulling your leg over. You will still get a stretch, but you'll feel it in a different area this time. This is completely passive, so your leg should not be doing any of the work. You should only be pulling with your hands. So that can be another good stretch for that sciatic nerve, as well as your hamstrings, which can all be tight, which could all be pulling on that nerve. So like I said, that stretch, that exercise will be good for a number of things. Stretching that sciatic nerve, as well as your hamstrings, possibly help your lower back, your hip mobility, all of those things in one. But this video is focused on the sciatic nerve itself. I could make a few other videos if you have anything coupling with the sciatic nerve injury, such as a bulging disc. I could make some exercises or make a video focusing on some exercises that will target that as well. However, this video is focused strictly on the sciatic nerve. So this last exercise, it could or could not be an issue for everyone, but that piriformis muscle that I keep talking about, the action of that muscle is to externally rotate your thighs. So it turns your hip out like this, turns your leg out like this. This would be internal, this would be external. So it's an external rotator, and sometimes if that muscle is working a little bit more than your internal rotators, then these internal rotators could possibly be weak. So we're gonna work on that. We're gonna work on fixing those internal rotators, strengthening those up a little bit. And so this next exercise is dedicated to just that. All right, so for this last exercise, we are gonna be doing glute bridges, but we're gonna add another step to it. So for these glute bridges, I want you to at least have a ball that you can squeeze between your legs, either a ball or a towel, something you can roll up and squeeze between your legs. In this case, I am using my jacket, but you can use anything, like I said, anything that you're able to put between your legs and squeeze. So this is how the exercise looks. You're on your back. Whatever object you chose, it's gonna go between your legs. You're gonna squeeze it, working on those internal rotators / those adductor muscles. You're gonna squeeze it, and while you're squeezing that, you're gonna bridge up. Make sure that your core is tight, and then you're coming back down and relax. Squeeze, bridge, come back down, relax the squeeze. Squeeze, bridge, come back down, relax to squeeze. Thank you guys for watching. If you made it this far, if you feel like this video was helpful in any way, please feel free to like, leave a comment, and subscribe to my channel. I'll be making more physical therapy focused videos. Like I said, I am a student right now, but I will be graduating in a few months. So yeah, thank you for watching again. Hopefully this helps you. Leave a comment if it does help you in the future, if you decide to use these exercises and you see some results from it. Thanks again. Much love, and see you in the next video. Bye.